Breast cancer, a term that evokes concern and vigilance, predominantly among women. But what if much of what we thought we knew about this disease was only a part of the story? In a world where breast cancer is often synonymous with female health, there lies a hidden narrative about its impact on men, shattering the gender barrier in disease perception. And while the search for a lump has become almost a universal mantra, the reality of breast cancer's telltale signs is far more complex and elusive. Join us as we delve into these overlooked aspects, unraveling the truths that could redefine our understanding and approach to breast cancer. Stay tuned, because what you're about to learn might just change everything. If you are new to my channel, I am V, and welcome to the best health channel on YouTube, where we talk about everything about health. What is breast cancer? Breast cancer, a term shrouded in both fear and misunderstanding, is more than just a medical diagnosis. It's a complex maze of biological rebellion within the body. At its core, breast cancer arises when cells in the breast grow out of control, forming a malignant tumor that can potentially spread to other areas. These cells, once ordinary components of the breast's anatomy, begin a treacherous transformation, defying the rules of normal cell behavior. But here's where it gets intriguing. Breast cancer isn't a singular enemy but a multifaceted adversary, with variations that challenge our one-size-fits-all understanding. Can men have breast cancer? You may ask. Yes, they can. Breast cancer is much more common in women than in men. Here's a simple way to look at the statistics. For every 100 women who get breast cancer, only about 1 man will get it. This means that while breast cancer is a major health concern for women, it's quite rare in men. However, it's still important for everyone to be aware of the risk, no matter how small it may be. Especially the men whose mothers or sisters have had breast cancer. You may have questions like, what are the risk factors of breast cancer? Or who are at risk of developing breast cancer? Or even how to reduce the risk of breast cancer? Breast cancer risk factors and causes are numerous, and understanding them can help in early detection and prevention. Here are 12 key risk factors. 1. Gender. Women are at a significantly higher risk than men. That does not mean that men can't get it or aren't at risk. 2. Age. The risk increases with age. Most breast cancers are diagnosed after age 50. While this may be true, it has also been confirmed in your women. 3. Genetic mutations. Inherited mutations, like those in the BRCA1 and BRCA2 genes, significantly raise the risk. 4. Family history. Having a close relative with breast cancer can double one's risk. 5. Personal history of breast cancer. Someone who has had breast cancer is more likely to have it again. 6. Radiation exposure. Previous radiation treatment to the chest area, especially during childhood or young adulthood, can increase risk. 7. Reproductive history. Early menstrual periods, before age 12, and menopause after age 55 expose women to hormones longer, raising the risk. 8. Having dense breasts. Dense breasts have more connective tissue than fatty tissue, which can sometimes make it hard to detect tumors on mammograms. The more fatty your breast is, the less the risk. 9. Certain breast changes. Having certain benign, non-cancerous breast conditions may increase risk. 10. Hormone replacement therapy, HRT. Long-term use, especially combined estrogen and progesterone, has been linked to an increased risk. 11. Alcohol consumption. Drinking alcohol increases the risk of breast cancer. 12. Obesity. Being overweight or obese, especially after menopause, is linked to a higher risk of breast cancer. It's important to note that having one or more of these risk factors doesn't mean someone will definitely get breast cancer. Many people with several risk factors never develop the disease, while others with no apparent risk factors do. Regular screening and awareness of personal risk factors are crucial. How does breast cancer develop? Picture this. Within the delicate architecture of the breast, a realm of cells dutifully follows life's rhythm, multiplying and dying as dictated by the body's intricate biological cycle. However, in breast cancer, this harmonious cycle is disrupted. A rogue cell defies the natural order, mutating and beginning an unwarranted proliferation. These cells, once part of the body's symphony, turn into renegades, growing uncontrollably and forming a mass, a tumor. Some of these cells can be aggressive, invading nearby tissues and, through a process known as metastasis, can even embark on a sinister journey to distant body parts. Hormones like estrogen and progesterone, usually playing nurturing roles in the body, can sometimes fuel the growth of these cancer cells, adding complexity to this already intricate condition. What are the types of breast cancer? Breast cancer can present in various forms, each with its unique characteristics and implications for treatment and prognosis. Here are some of the main types of breast cancer. 1. Invasive ductal carcinoma, IDC, the most common type, accounting for about 80% of all breast cancers. It begins in the milk ducts and then invades nearby tissue in the breast. Once it has spread to the surrounding breast tissue, it can also spread to other parts of the body. 2. Invasive lobular carcinoma, ILC. This type starts in the lobules, glands that produce milk, and then spreads to the surrounding tissues. About 10% of invasive breast cancers are ILC. 3. Ductal carcinoma in situ, DCIS. A non-invasive cancer where abnormal cells are found in the lining of a breast duct, but they haven't spread outside the duct. It's considered the earliest form of breast cancer and is highly treatable. 4. Lobular carcinoma in situ, LCIS. This is not a true cancer but an area of abnormal cell growth that increases a person's risk of developing invasive breast cancer later on. It begins in the milk-producing glands but does not invade through the wall of the lobules. 5. Triple-negative breast cancer. This aggressive form lacks estrogen and progesterone receptors and doesn't have excess HER2 protein. What is HER2 protein? You may ask. It is the human epidermal growth factor receptor 2 which is known to promote cancer growth. This type tends to be more aggressive and has fewer treatment options. 6. HER2 positive breast cancer. Characterized by cancer cells that have too much HER2 protein, which promotes the growth of cancer cells. This type can be aggressive but may respond well to targeted therapies that attack the HER2 protein. 7. Inflammatory breast cancer, IBC. A rare and aggressive form of breast cancer that makes the skin of the breast appear red and swollen, inflammation, due to cancer cells blocking lymph vessels in the skin. There are other types, but these are the most popular. Each type of breast cancer can behave quite differently and requires a tailored approach in terms of treatment and management. Understanding the specific type of breast cancer is crucial for effective treatment planning. For proper treatment of breast cancer, you need to understand the stage at which the breast cancer is. Breast cancer stages reflect the size of the tumor, its spread to nearby lymph nodes, and whether it has spread to distant organs. This staging helps determine the prognosis and the best treatment options. Here are the main stages of breast cancer. 1. Stage 0 breast cancer. Known as in situ. This stage refers to non-invasive breast cancers, like ductal carcinoma in situ, DCIS. In this stage, abnormal cells are present but have not spread to nearby tissue. 2. Stage 1 breast cancer. This is an early stage of invasive breast cancer. Stage 1A. The tumor measures up to 2 cm, cm, and has not spread outside the breast. Stage 1B. Small clusters of breast cancer cells, larger than 0.2 mm but not larger than 2 mm, are found in the lymph nodes, and either there is no breast tumor, or the tumor is less than 2 cm. 3. Stage 2 breast cancer. Divided into subcategories 2A and 2B. Stage 2A. The tumor is either less than 2 cm and has spread to 1 to 3 nearby lymph nodes, or it's 2 to 5 cm and hasn't spread to any lymph nodes. Stage 2B. The tumor is either 2 to 5 cm and has spread to 1 to 3 axillary, underarm, lymph nodes or internal mammary lymph nodes, or it's larger than 5 cm but hasn't spread to any lymph nodes. 4. Stage 3 breast cancer. This stage is considered locally advanced cancer. Stage 3A. The cancer has spread to 4 to 9 axillary lymph nodes or has enlarged the internal mammary lymph nodes. Either there is no sign of a primary tumor in the breast, or the tumor may be any size. Stage 3B. The tumor has invaded the chest wall or skin and may or may not have spread to up to 9 lymph nodes. Stage 3C. There is no sign of cancer in the breast or, if there is, it can be of any size and has spread to 10 or more axillary lymph nodes, lymph nodes near the collarbone, or internal mammary nodes. 5. Stage 4 breast cancer, known as metastatic breast cancer. The cancer has spread beyond the breast and nearby lymph nodes to other parts of the body, such as the lungs, distant lymph nodes, skin, bones, liver, or brain. The stage of breast cancer is determined at the time of diagnosis and is critical in deciding the course of treatment. Each stage has its specific characteristics and treatment protocols. Early detection and treatment significantly improve outcomes, especially in the lower stages. What about the overlooked early symptoms of breast cancer? Early symptoms of breast cancer are often subtle and can be easily overlooked, which is why awareness is crucial. Here are some of the most commonly missed early symptoms. 1. Change in breast texture. Changes like thickening or a noticeable difference in texture can be an early sign. The skin might feel harder or denser in some areas compared to the rest. 2. Nipple changes. Early signs can include the nipple turning inward, inversion, or changes in its appearance or texture. Some people might dismiss this as a harmless change without realizing its potential significance. 3. Redness or flaky skin. Redness or flaky skin in the nipple area or the breast can be an early symptom. It's often mistaken for a skin irritation or allergy. 4. Nipple discharge. Discharge other than breast milk, especially if it's bloody, clear, or of an unusual color, can be an early warning sign. This is frequently overlooked, especially when it's not accompanied by a lump. 5. Pain in the breast or nipple. While breast cancer is not usually painful in the early stages, any new, unexplained pain in the breast or nipple that persists should be evaluated. Don't overlook this symptom, especially if it happens when you are not on your period. 6. Swelling in the armpit or collarbone area. Swelling in these areas, even before any noticeable change in the breast itself, can indicate early breast cancer. This swelling is often due to lymph node involvement and can be missed if one is only looking for breast changes. 7. Change in breast size or shape. A slight change in the size or shape of one breast compared to the other can be an early sign. This is often subtle and can be missed if not specifically looked for. 8. Dimpling of breast skin. Sometimes, an underlying tumor can pull on the skin, causing dimpling or puckering, resembling the skin of an orange. This is often missed, especially if there's no distinct lump. 9. Persistent breast or nipple itchiness. Persistent itchiness of the breast or nipple, not relieved by creams or ointments, can be an early sign, often mistaken for a skin condition. 10. Breast or nipple tenderness. While tenderness can be related to menstrual cycles, persistent tenderness, especially when it's localized to one area, should be evaluated. Remember, these symptoms don't necessarily mean breast cancer, as they can be associated with benign breast conditions. However, if you notice any of these changes, it's important to consult a healthcare professional for a thorough evaluation. Early detection of breast cancer significantly improves treatment outcomes. In addition to the early symptoms, breast cancer can present other signs as the disease progresses. These symptoms may be more noticeable and should prompt immediate medical attention. Here are some additional symptoms to be aware of. 1. Lump or thickening in the breast or underarm area. A lump that feels different from the rest of the breast tissue is one of the most common symptoms of breast cancer. It's important to note that not all lumps are cancerous, but they should always be evaluated by a healthcare provider. 2. Puckering or dimpling of the skin. Sometimes, breast cancer can cause changes in the skin that make it look like an orange peel, known as peau d'orange, due to the tumor pulling on the skin. 3. Visible veins on the breast. A noticeable increase in the size or number of veins on the surface of the breast can be a symptom. 4. Change in color of the breast. The breast may show redness or other discoloration, which should not be mistaken for a simple rash or infection. In conclusion, building on this foundation, it's essential to foster a supportive community for those affected by breast cancer. This involves not only providing medical care but also ensuring access to resources such as counseling, support groups, and patient education. Advocacy and continuous research play pivotal roles in improving treatment options and outcomes. As we look towards the future, the importance of personalized medicine in breast cancer treatment cannot be overstated. With advancements in genetic testing and molecular profiling, treatments can be more effectively tailored to individual patients, potentially improving outcomes and reducing side effects. Watch out for my next video on breast cancer, where I will talk about the complications, diagnosis, medical and natural treatment of breast cancer diet and preventive measures. Please subscribe to be notified when this video is out, and if there is anything more you want me to talk about regarding breast cancer, please write it in the comment section or send me an email at drvhere@gmail.com. Thank you for watching and see you in my next video. Wishing you a very beautiful and healthy life.